But the step that is being taken with the implementation here in Arizona and across the country is a significant step. And as Dr. Perez mentioned, and I have said it before, one of the things that, and this includes myself and it certainly includes the administration, as we go forward with implementation, there are going to be glitches, there are going to be unanticipated problems, and maybe some unanticipated consequences as a result of implementation. The smartest and the correct thing for us to do, as not only as an administration, is to look at that situation. If there's merit to something that needs to be done on the regulatory side or on the emphasis side or on the funding side or on the inclusion side that isn't in part of the act now and administratively can be dealt with, we should do it and not get defensive about those things and not delay and not expose ourselves to bigger targets in this implementation process than we should be. This is too important of a program to get too petty about one particular thing that probably does need changing. Let's change it, move forward, and keep this momentum for the plan going. The district I represent, District 3, has about 300,000 plus women, 200,000 plus children. And I mention those numbers because each district is about 800,000 people. So this is a huge percentage of this district. And the forum today and at other places has been talking about the Affordable Care Act and how it affects those two significant populations. And the constraints around Medicaid access here in the state, kids care, the reductions there, and also ineligibility for many women have lowered the capacity to health delivery for a lot of women and a lot of children in this district, and I would say that's replicated across the state. Arizona had a chance to be in the driver's seat in terms of implementation and setting up the exchange. They chose not to. And so that gives the responsibility to the federal government. And for me, it is both, it's an opportunity, and this is why these forums are so important, and I hope all my colleagues are conducting these kinds of discussions, because we can have some input into how that exchange is implemented, what the criteria is going to be, and come October, maybe have a smoother package than many people are anticipating at this point. And the implementation with it already brings some positives. Kids up to 26 continue to be taken care of in terms of overall coverage on their parents' form. And I think that is going to be tremendous benefit to many, many young people. The bar on denial for pre-existing condition, important. The 80-20 rule, important. That 80% of what you pay has to go into patient care and 20% into the administrative margin of any company that's doing business with the exchange. I think also, and can't deny coverage to women for pre-existing conditions. Has to be equity in what you charge and what you offer for women, and a special emphasis on children. And all Americans joining the new insurance plans have the freedom to choose from any primary provider for women in their health plans network. So without a referral, doesn't require a referral. I think that's going to be an important part of this whole process that we're going to go through leading up to October. What's also going to happen, though, is the process of signing up, how intense that's going to be, and for providers and people that deal with people on an everyday basis, the demand for information and what should I do and what shouldn't I do. And I think that's part of these forums too, to begin to clarify that and to begin to provide the information people are going to need. Patient's Bill of Rights, we're going to make sure people have that. There's going to be money for school-based clinic. There's going to be money for family and maternal visits. so that women have that attention on a daily basis. And there's going to be $11 billion for services, expansion for community health centers in the state of Arizona. And I say that because I think part of the intention of Affordable Care Act was to emphasize all providers, but to begin to look at community-based delivery as one of the primary areas in which we want to provide services to communities. Right now, there's going to be immediately about 17 of the health centers are going to receive an immediate infusion of money in order to begin to assist uninsured Americans who want to be part of the exchange and begin to educate them as to the choices and what is the best for them as an individual or as a family. And like I said earlier, I think we're setting the stage here for something that can be very, very good. During this whole period of we'll be working on this, there will also be the political fight. So I think the House of Representatives repealed it 38 times since we passed it. And I'm sure there'll be a couple more exercises about that. I'm sure there's going to be an effort to make it a pivotal issue during the upcoming elections. That's all anticipated and expected. I think the path of the professional community, patient advocates, providers is going to move the process forward, irrespective of that. I happen to think that for Arizona, this is a huge opportunity. And we're still going to be having to go through the machinations of healthcare reform and the health coverage to someone that really receives legal status in that country, in this country, provisional and permanent legal status, about making sure that there's an extension of services. If the government recognizes your status as legal and permanent, then there should be some attendant eligibility to receive the services that should be provided, as opposed to barring that person from ever receiving any health service in this country. Even barring them if they have their own capital to be able to go to the exchange and purchase their own insurance. And if you go to an emergency room, unless you can prove that you have the equity on the spot, that you would be denied services. Small constitutional issue will rise there, but we'll see how that, but the point I'm making is all those things will be going on around us, and I think this is so huge that we just have to keep pushing this process forward. We wanted the regional person from CMS to be here, had a conflict. He owes us a return engagement, and he will return, because I think for providers and other people, there are questions that he needs to deal with and hear from this community. But today you have an outstanding panel. Advocates across the board, distinguished in their fields, and particular advocates of making sure that healthcare is accessible to everyone. And I think the mark of a healthy nation is not just the wealth that we own, but the health that our people have. And we have to understand that in this district, median age is about, my district, 17, 18 years old. Very, very young people. So healthcare to me is not just about getting the help to people that have not had it immediately, but to build a legacy for these babies that are coming up. And so primary interest to me is the children, women, and signing up as many uninsured as we can. That is the limit. They're not limited goals, but they're goals. And counting on the providers to make sure that as we go through this process and coverages and glitches appear, that you confront us with those early on, so that if there's a remedy, we pursue that remedy immediately. I'm very proud to be here with these folks. I know all of them. I admire them. Some I fear, but other than that, there's a couple that will give you an earful about what we should be doing, and 99% of the time they're correct. Healthcare has always been a forgotten issue. And if you had it, the money, and if you had the job that provided it, you got it. And if you didn't, you were on your own. And in a state that minimizes healthcare delivery, between you and I, having an opportunity for the community and your congressional delegation and the professional folk in this state to help craft what that exchange and that accessibility and that affordability is going to be is a good thing.